To me, a celebrity who's aging gracefully is somebody who looks the best at their age, who doesn't look like they've had much work done or any work at all, and who looks like the best version of themselves. People who come to mind are women like Helen Mirren, for example, who looks absolutely beautiful for her age, who doesn't look like she's had multiple procedures and is very recognizable when you look at her younger photos. Julia Roberts, when she smiles, she still lights up a room like she did 20 years ago. And unlike some celebrities who have gone too far, her expressive face is just as naturally lovely as her resting face. George Clooney is another male actor who we all know who looks even better now than he did in his 30s. And that is all because of being consistent with good grooming habits, avoiding the sun, and maybe doing minor procedures here and there without altering their appearance. Incorporating injectables without looking done means doing discrete amounts at a time, respecting someone's natural features and not changing them, but subtly enhancing them to make them look like the best version of themselves. There needs to be a strategic plan in place before the treatment even begins, and a very good understanding between the physician and the patient to make sure that their emotional attributes match their expectations. The age at which patients are starting aesthetic treatments is a very interesting question, because traditionally we think of these treatments as anti-aging treatments. But in fact, these treatments are now also beautification treatments. So when you're at a legal age, of course, if there's a minor imperfection like a bump on your nose that you'd like to correct, you can now do that. If younger patients want to achieve a specific lip shape, it is now possible. So we are seeing younger patients coming in and addressing specific concerns that they have, more for beautification reasons than for anti-aging reasons. And then we have the large demographic of patients who are aging positively and want to look their best throughout all the decades of life. A consultation entails a thorough assessment with a patient and understanding them as a whole, not zoning in on one facial feature. There are emotional attributes associated with aesthetic concerns. There are health issues associated with many aesthetic procedures, and it's important to see the patient as a whole, as an entire human being, to understand their expectations, their fears, their concerns, and also to deliver on the results that they are hoping to achieve. The consultation also involves analyzing their skin. Injectables are not necessarily going to improve the health of your skin. So getting a thorough consultation in terms of skincare treatments, laser procedures, essentially non-injectable services for that comprehensive approach to a healthy looking skin and the best version of your face. One of the treatments that our patients love the most for the instant results it delivers is our mist lift procedure. This is a treatment where I essentially call it an anti-fatigue treatment, where we treat volume loss under the eyes that can sometimes make us look tired, no matter how energized we feel or how well we've slept. So the treatment involves giving a lifting effect to the cheek area, a smoothing effect to the under eye area, so that it essentially looks like you've had the best sleep of your life without looking like a different person. The secret to delivering natural results is having a thorough understanding of what the patient expectations are, and also having a subtle hand when performing these procedures. I would say the majority of our patients come see us requesting natural outcomes, so it would make no sense to deliver unnatural results. I would say the secret to maintaining natural results is to have a good patient-doctor relationship where you understand the value of continuity of care and coming in for regular follow-up appointments to maintain natural results rather than trying to achieve unnatural results in a short space of time. I think one of the greatest advancements in aesthetic medicine has been the change in approach to the patient when performing injectable procedures. Traditionally, fillers were viewed just like that, fillers. They would fill the face, make the face look rounder and puffier. But we've adapted our techniques now that the focus is on looking lifted, looking rested, looking like a natural but best version of yourself. What's also helped is the improvements in the quality of the fillers that we now use. There used to only be 1 or 2 types that one could use, and a lot of them did not give very natural results as they were quite rigid. Our newer fillers allow us to use light densities under the eye, medium densities in the cheek, and very, very high densities to actually give structure and shape to the face, for example, in the jawline. I think it's a very exciting time in aesthetic medicine because we can now deliver results that often resemble a surgical outcome using all these various tools that we now have accessible to us. Celebrity culture has significantly influenced aesthetic medicine, especially with the rise in social media. Celebrities are more comfortable discussing their procedures, showing their procedures, actually collaborating with injectors and having their procedures filmed and documented. This has made a lot of people feel more comfortable with the idea of having a cosmetic procedure, whether it's something very minor to something more significant. And we have definitely seen a rise in aesthetic procedures as a result of this.